Motivations with Glenn.
Good day, everyone. Thank you for tuning in to Awesome Radio, to the Glenn Johnson Show. Here on Awesome Radio, 107.5 FM, 1570 AM, WECU. Our topic of discussion today is a continuing topic on Breast Cancer Awareness Month 2025. Today, we'd like to begin with Breast Cancer Awareness Month 2025 for men, which runs from October 17th to the 23rd, which is tomorrow. But men, ladies and gentlemen, particularly the gentlemen, you don't have to stop because it runs to the 23rd, which is tomorrow. You should continue to observe yourself, monitor yourself, and get checked out to make sure that you don't have breast cancer. That goes for men and women. And we also have a document from talk show host and comedian Sherry Shepard. We definitely want to play the audio that she made available on YouTube. It's quite awesome. But I noticed my co-host, Apostle Jacqueline Williams, before we went live, she's on in her studio writing down stuff, highlighting stuff. So, ladies and gentlemen, without further ado, let me welcome my co-host, Apostle Jacqueline Williams.
Hey, Dr. Glenn, and to our listening audience on today. And not only was I highlighting, I also have my sticky notes.
I know you do.
I have my sticky notes with me just in case I needed to jot some things down. Well, Dr. Glenn, I am so glad that we are doing this subject again for a second time, because this is actually the first time that I have and that I know of that we have done the Breast Cancer Awareness Month on this platform. And so I'm very excited too about doing a part two, and also, you know, how awesome our broadcast was on last week, and even having our guests on the line who came to share about their experience with breast cancer.
Yeah, actually, she wasn't a guest. She was just a call-in, but she might well be considered a guest because she stayed on for about 30 minutes.
Yeah, well, our call-in, I don't want to say it was a formal guest, but she ended up, you know, telling us some very good things as she called in about breast cancer.
Yeah, which was good, by the way.
And sharing her experience. And I think it was a very, very powerful thing to hear her testimony of how she overcame and how she was healed from breast cancer. And so we today, you know, Dr. Glenn, there was also one thing that we didn't do last week, and I'm going to do it today. And before we start our subject with breast cancer, I can't wait to hear Sherry Shepard's her audio here that we have, and because I know that she mirrored some things that I talked about on last week about having the mammogram.
The mammogram, yeah.
And some things that I said that may have been also funny. Listen, I'm not as funny as Sherry Shepard, but I know I've been through the experience.
Well, we have 6 minutes before we go to the break. When we play that audio clip, Sherry Shepard now.
Can we do this one first, Dr. Glenn, that we forgot last week?
What?
And we were talking about North Carolina became the first e-court state.
Oh, yeah.
Yeah, this was very important. I felt like we needed to do this and start out and kick off this show with this because we forgot to do this. We didn't have time to do it on last week.
That's great.
And we need to do this. And so Monday, October 13th, um, North Carolina is the first e-court state. And what this means is that they are now doing court over the internet. And I think this is a powerful and a wonderful thing, especially if you have ever had to go to court and you've ever had to go down and you've had to sit there and you've had to wait. I know my experience with a ticket one time is that I was there almost all day. And I was sitting there for a long time waiting on case after case after case until they got to me. And I think that process was very tedious for myself.
Yeah, but you know what I just thought of? There should be no more excuses and no more warrants for failure to appear. You just go on the computer and log on.
Well, some people are going to still not show up, Dr. Glenn. Because I'm kind of wondering how it goes with sentencing. Maybe they don't do the sentencing over the internet, because I'm just saying, this is me now. I'm not a criminal. I've never done anything criminal, but I'm just thinking if they sentence you to life and they done it over the internet, I might not show up. that might be their last time seeing. I'm just saying, I know they're probably not doing certain things over the internet because of that.
But it's all a matter of public record. So therefore, they probably would be doing the e-court sentencing as well because it's a matter of public record.
Well, it says North Carolinians benefit from this in many ways. In all 100 counties, paper records have now been replaced with online access to justice, meaning that anyone with an internet connection can file court documents. That's another thing. You can file it over the internet and not have to go down there.
That's right.
I see that as a very powerful thing. Search for records or have 24/7 access to case events and court dates from the comfort of your own home. Nearly 6 million electronic filings have already been accepted. That means that people were excited about seeing this electronic system come into play.
Yeah. And while we're on that, let me just mention one thing. I'm a retired corrections sergeant from New Jersey. I always had a problem with the correctional system that went privatized because actually and technically and legally, I think that the person that has been sentenced and that's incarcerated at one of those private facilities is not a ward of the state. The state has no control. And this is what I'm thinking. So I think that when they would privatize some states, it was a big mistake.
Well, there are going to be people that are going to be looking out for money in every system. And of course, there's a lot of money to be made in housing prisoners and what is being paid by the state to take care of those prisoners. So people are going to have their hands out and try to get into that, Dr. Glenn. So that's why we have those private prisons.
And I'm pretty sure the state is paying out royally to those private sectors.
Definitely, for all the food, the housing, and the guards and different things. I mean, daily, it takes a lot of money. And I did hear the amount once of how much it costs to house a prisoner for one day. Those people are making that money.
Yeah.
They're making that money. Those prisoners are not living in luxury, but they're being taken care of, and that money is being made concerning them daily. And so, Dr. Glenn, we need to finish this document. I'm trying to get through a few things before this break so we can go right into the breast cancer month.
Okay. And
so it says here that it's saving many costly trips to the courthouse and over 20 million sheets of paper. So they've saved a lot of trees, Dr. Glenn, according to this, by doing the e-filing. So that's a big thing too. That's a big money saver. More than 5 million searches are conducted monthly through the new online record portal. And so I'm just want to say that those of you, that you may have something that you need to file, sometimes, people have things that they have to file yearly down at the courthouse. I mean, there's a lot of things. You get a ticket. I mean, you get married. There's a lot of things. I don't know about the marriage thing.
I think that more or less has to be in person.
Yeah, some of them, I don't know the details of all of it, but we will definitely find out and get some more information on that, because I don't know that you should be able to file a marriage online. You got
No.
your IDs and things, but hey, who knows? They may have you to upload it right there and you're able to do it.
But that should be done in house. That should be done in person.
That's what I think as well. But Dr. Glenn, hey, I don't know. This new technology, things can get very, very complicated, and people are able to do a lot of things online. We'll find out about the marriage portion of it. Hey, we're getting ready to go out on our first break here, and we want you to hang in there with us and come right back, because when we come back, we're going to share an audio from Sherry Shepherd, and she's talking about her experience with the mammogram machine. And I am excited to hear about it, and I want you to come on back. Hey, if you want to call in and be live on the air with us, the phone number here at the studio is 252-756-2008. You can call in and be live on the air with me and Dr. Glenn. Hey, this is Awesome Radio, the Glenn Johnson Show. Back in a moment.
My name is Jayla, and you're to see to my papa, Glenn Johnson, on the radio.
In Jonah's day, Nineveh was considered a huge city. Thanks for connecting with Today in the Word. I'm John Gager. In Jonah's day, few cities reached the 10,000 mark population-wise. At its height, Babylon had a population of only around 200,000, yet it was considered the largest city in the world. So Nineveh, with its population of 120,000, was significant by ancient standards. Besides having a large population, Nineveh was extremely wicked. Today in the Word, we read God's assessment in Jonah 1, verse 2. Go to the great city of Nineveh and preach against it, because its wickedness has come up before me. This description of Nineveh's wickedness will remind many readers of Sodom. God said the outcry against Sodom and Gomorrah is so great, and their sin is so grievous. In the story of Sodom, described in Genesis 18, Abraham eagerly interceded on behalf of the righteous. He was trying to convince God to spare the entire city if only 10 righteous people could be found. Since those 10 weren't found, the Lord destroyed the city. Well, the prophet Jonah is here put in a similar position. The original readers would have picked up on that comparison right away because of their familiarity with the Pentateuch. Therefore, we're primed in Jonah 1, verses 1 and 2, to think that Jonah will be a compassionate prophet like Abraham and will graciously intervene for the great city of Nineveh. Instead, we quickly find out that Jonah held a much different response. Rather than intercede for evil people, Jonah would attempt to withhold God's word from them. Hey, how do you respond to wickedness? With compassion or judgment? You can share today's devotional with a friend or two at our website, todayintheword.org. That's todayintheword.org.
I am Miss Mary Cox. I'm Killer Thigpen's mother from Awesome Radio.
Welcome back, ladies and gentlemen, to the Glenn Johnson Show. Motivations with Glenn and Apostle Jacqueline Collins-Williams. I believe she wants me to go to the Sherry Shepherd audio clip. Is that correct?
Yes, we can do that right away, Dr. Glenn.
There we go. And by the way, this is the short version of her audio. There's a longer version because you know Sherry Shepherd is a talk show host and a comedian. The longer version has some display of her comedic style. So we're going to play the short version, which is about 2 minutes and 34 seconds.
Now, when you go get your mammogram, the nurses, they are so calm because this is normal to them. But let me tell you, there is nothing normal about flattening up your boobs into a pancake. And this is what I'm like, there's no foreplay at all. The nurses they don't say, hello, how are you doing? I'm nurse so-and-so. Who are you? How you feeling? There's no trying to put you at ease, all right? They just take out your boob, plop it on to this mammography machine, or as I like to call it, the torture chamber. And then let's talk about what you got to wear. You standing in a cold room in a paper robe. It's covering you up, your booty hanging out. Air all over your booties. And then you turn it around, you got to open it up. Your nipples are full of tension. Somebody done scared your nipples away now because they ready for the pain. They like, what's going on? And I can't push them back in because they're getting smashed to smithereens. And the nurse always says, it's only going to be like this for a second, but it feels like 3 business days. And it's sitting there in that machine, and then they come back and tell you, you know, the tissue is too dense, so they got to flatten it up even more. Like, and then I've never had them pull. I'm like, there's nothing more to pull. They pull, and it's like they're ironing your doggone breast. Now, here's the thing. Now you pushing them to get them in there. My whole life, I've been trying to push these babies up. Now you flattening them out. And then you got to sit there while they, you know, because they put it in there, you and all this pain, they run 3 rooms down to hit the button. So then the lady comes back and says, oh, we saw a couple wrinkles in the film. I said, I know, half of they call stretch marks. That's it, wrinkles. Then the nurse says, I gotta do it again. Before you can say anything, she runs out the room again. Then the nurse comes back, and before she can even speak, I begged that lady. I said, please don't tell me we have to do this one more time. And she said, oh no, Miss Shepherd, it was perfect. Now for the other boob. That's it. And I said, I forgot I had 2. Oh. But I do want to say this to all my sisters and all of the young ladies, go and get your mammogram. The pain is worth it. Do you know what October means?
Okay, that was the Sherry Shepherd audio. We're going to go to the Sherry Shepherd document right now because I want to point something out to Apostle. Doing the research in this particular document, at the very beginning it says Sherry Shepherd is a breast cancer survivor. But if you go down the page a little bit, it states that, oh, wait a minute, I just said it. It states that daytime talk show host Sherry Shepherd has not had breast cancer, but she has used her platform to raise awareness about the disease for Breast Cancer Awareness Month. She has shared her mammogram experiences and hosted segments featuring breast cancer survivors. So I don't get when they say she is a breast cancer survivor. Then at one moment they said she was not, but she's an advocate for breast cancer awareness.
Yeah, she is not. She did not have breast cancer, but she did have a breast reduction surgery. And I think that's what this document has in a mistake. They have her up here as if she survived breast cancer, but she had a reduction because she was having some back trouble, you know, and she needed to get the reduction for that. And
Yeah, I did read that in there.
yeah, so that was it. But this was her personal journey about her own experiences, and I'm very grateful and I'm thankful for the humor because sometimes, you know, it can be some of the situations or medical tests and things that we have to go through, they can be, you know, a little bit uncomfortable. And, you know, I've had mammograms and many women have, and we've all experienced the same thing, that machine just gets and smashes your breast and as she said, flattens it right out. And, you know, I've heard and asked, you know, women, we talk. So I've heard some ladies say that it wasn't painful at all, but I think it's according to how dense your breasts are. You know, if you don't have as much, then them smashing it doesn't hurt as bad as when you're more heavy chested. And so I believe that is a great difference. And then she missed, I don't know that they didn't do this with her, but I know that they turned the machine and kind of twisted with it, you know, to a different side, or you got to twist your body. It's either they twist the machine or they twist your body because they're trying to get a different angle, and it's already in there being smashed and then twisted at the same time. It can definitely not be a great experience.
Wow.
And I said, and I've always said from day one, from first time I ever had one, that horrible machine was invented by a man. Because I'm saying with all this technology and stuff, there has to be a better way than getting in there and smashing, the breast in order to get those pictures. It needs to. Where's the update? Where is the new technology
Yeah.
that just, you stand there and it just scans you from left to right and just takes care of it. I don't understand who came up with the pancake smasher.
Well, I'm actually glad you mentioned that because I did want to do some further research on is there any updates for the mammogram. Also to check out and see if a male has to go through a mammogram also to find out if the male has breast cancer.
Well, they can't because they don't have anything to smash in the machine, or at least unless you are over. You got to be heavy, or carrying a lot of weight. So I'm sure they don't do it the same way that they do with women.
Yeah, that's why I wanted to do research on it to find out.
Yeah, that's a great question, Dr. Glenn. And I think we need to put a pin in that regardless to what we do next week. We need to kick off with just that information. How do they do the mammogram for the men? And listen, I'm going to be definitely upset if they're getting a different process and we have to go through the smasher and they don't have to do the same thing for men. I'm definitely, I'm going to have an issue with that because we all need to be treated equally. Dr. Glenn?
Well, I'm about to go ahead. We got 1 minute before we go to break. Let me research something right quick.
Yeah, so I appreciate also Sherry Shepherd, in her bringing awareness to Breast Cancer Awareness Month and her doing that publicly on her platform. There are a lot of people that have survived breast cancer, and the awareness needs to continue to be out there. I have even seen, at my location of employment, some kids wearing the breast cancer pin for Breast Cancer Awareness Month. And we know that it's the pink ribbon, and we are seeing that everywhere. I would love to see more on television reminding us about Breast Cancer Awareness Month. Dr. Glenn, do you have that?
I do. 1 minute ago. I'll be brief. Yes, men can get mammograms. While mammograms are typically associated with women's breast cancer screening, men can also develop breast cancer, although rare. Men with certain risk factors may benefit from mammogram to detect the disease early on. But what I want to find out is how they do it.
Yeah, that still didn't tell us anything, Dr. Glenn.
Oh, wait a minute. It says mammograms for men are performed in the same manner as for females, using a specialized machine to compress the breast tissue and take x-rays.
Wow. So again, like I said, I don't understand how it's possible, but how would they suspect? I don't know. It has to be a certain criteria to suspect it for men. Hey, we're getting ready to go out on a break again. We want you to come right back with us, and we'll be right back in a moment. This is the Glenn Johnson Show on Awesome Radio.
I am Miss Mary Cox. I'm Killer Thigpen's mother from Awesome Radio.
Street preaching is a wonderful tool for spreading the gospel when it's done the right way. Stay tuned.
That's attorney David Gibbs Jr., and this is the Legal Alert.
We here at the Christian Law Association appreciate and adore the brave men who preach the vital news of the gospel on our city's streets. It's a time-honored, Christ-honoring practice, and we have defended this right constitutionally again and again. Great men like Billy Graham and D.L. Moody were street preachers. However, unfortunately, now we're receiving more calls of late from certain street preachers becoming a bit salty in their language, not polite. Their choice of words about people they disagree with are not good. This isn't wise and it isn't godly. It's so important to do the right thing the right way. Let me repeat that. It's so important to do the right thing the right way. And to do it the right way, let your speech always, as the Bible commands, be seasoned with grace. Street preaching is a protected constitutional right, but do it with the right spirit.
Our free newsletter addresses lots of issues, like the ones we've been discussing today. It's an invaluable tool. Why not sign up for it now at christianlaw.org. christianlaw.org.
We're back. You're listening to The Glenn Johnson Show. You can reach Glenn at glennjohnsonshow@gmail.com.
Welcome back, ladies and gentlemen, to the Glenn Johnson Show. Motivations with Glenn and Apostle Jacqueline Collins-Williams. Here on Awesome Radio, 107.5 FM, 1570 AM, WECU. We have reached our final 30 minutes of today's broadcast. So we would love to hear from our listening audience. If you have a comment or question, please don't hesitate to call in within the next 30 minutes to 252-756-2008. And I definitely want to play that audio clip again about the triple negative breast cancer, because that's on my mind. I want to hear what they were saying about that.
Yes, Dr. Glenn, you want to do it now?
Yes.
Dr. Conley, a lot of women have triple negative disease. We do know that triple negative can be aggressive and some of the treatments may not be as effective. Could you talk a little bit more about triple negative and the best way to treat triple negative disease?
So, triple negative breast cancer indicates a breast cancer that does not have one of the three targets that we look for. It does not have expression of the estrogen receptor, the progesterone receptor, or the HER2 receptor, and that is why it's called triple negative. And so we do not have the option of using some of our targeted therapies in those patients. Hormone therapy and HER2-directed therapies are not effective in triple negative breast cancer. Treatments that can be helpful include chemotherapy, and we have many different chemotherapy options that we can use for patients with triple negative breast cancer. Usually for a patient with early stage breast cancer who is going to have surgery, we use combination treatment strategies where we're using 2 or 3 chemotherapies sort of close together. In the stage 4 setting, we have multiple agents that we can use. We oftentimes use them one at a time, but we do have many chemotherapy options that we can use. However, we strongly encourage participation in clinical trials to get access to newer treatments that may be more effective as well.
So there are many factors that influence a woman's risk of developing breast cancer. Being a woman is one of the major things, although breast cancer does happen in men, it's much more rare than in women. Breast cancer also becomes more common.
Okay, I just want to hear what they were saying about the triple negative breast cancer, because while I was playing, I had to Google, is there triple positive breast cancer? And it says triple positive breast cancer is a type of breast cancer that tests positive for 3 markers: estrogen receptor ER, progesterone receptor PR, and human epidural growth factor receptor 2, which is HER2. So triple positive breast cancer accounts for about 10 to 15% of all breast cancers. I just want to mention that in Google just to see if it was a triple positive, since I was so curious about the triple negative.
Definitely. And that triple negative is talking about more about how they treat it, and what it responds to versus, regular other treatments. So also, Dr. Glenn, we talked about getting the mammogram. I want to say to everybody on today, to especially all the women, I don't know all of the factors for men being tested, but I do want to say to the women that early detection is very positive, and you can have a more positive outcome with early detection. And as I said last week, this subject is very near and dear to me because one of my sisters passed away, and she was in her early 40s, and she passed away from breast cancer, but she did not have any mammogram or any screening. And that is one of the things that, caused her to pass away was because she didn't have those screenings and didn't have those tests. So early detection is very optimum for a positive, and there's so many people that have survived. But the fact that it could be in your body and not getting any treatment or not getting any, type of chemo or whatever it is, even if it's surgery, those things are very important. And so they recommend for women to start getting them at 40. That at least by 40 that you need to have a mammogram by the time you're 40. My sister, I believe, was 42 or 43 when she passed away. And so she had not had these screenings. And she had tumors there. And Dr. Glenn, one of our paper here talks about the difference between cysts and tumors. And I think we need to find that and begin to talk about that too, because having a bump or a lump doesn't necessarily mean that you have cancer. But having a lump or a bump, you definitely need to go and see the doctor to make sure. I also have a young relative that I know that was dealing with breast cancer. And I'm talking about in their 20s. And that's why even as young women, you need to be doing self-breast exams. If there's any lump or anything that you find there, I don't care if it's as small as a pea or some hard spot or something raised or something different, you need to make sure that you go and get that checked out and talk to your doctor about it.
Do you have any idea what document that might have been on?
I see it here, Dr. Glenn.
Yes,
I see it here.
Yes, yes.
It's right here on, let me see the first page. I could see it. It's on the several pages back. It's the Breast Cancer Awareness Month, 7 Things to Do.
Yeah.
It's on that one. And
It's
it
on the third
says,
page?
yes, so it's on page 3, I believe.
Yes.
It said breast cyst versus tumor. It's the difference in how they feel and more. It's updated September 2nd, 2025. Finding a breast lump can be concerning, but many lumps are harmless and may be caused by benign conditions like breast cysts. And it says breast cysts are among the most common causes of breast lumps. So a lot of times, more than not, that lump is just a cyst and not a tumor. And don't run, all the way to the worst end as soon as you find a lump or you feel something, and then all of a sudden you speaking that you have a tumor. You have to watch your mouth because it could not be a tumor. It could be just a cyst, and most of them are benign, and then it's probably something that they'll want to keep a watch on. Cysts and tumors feel different, it says here.
That brings me to a question. Obviously, I'm a male, so I'm not making fun of none of others, but my serious question is, do you think that a female that may be pregnant and during the pregnancy she developed milk, if that milk is not extracted and it remains in the breast, could that possibly cause cancer?
Well, I don't know that it causes cancer, but I know it can cause some pain. I do know that much, that when that milk is not expressed, you can end up with a clogged duct. And it can be hard like a cyst or a tumor, and it can be very painful, but it's usually so painful until you have to do something about it.
And that's why I thought about that when you were talking about the cysts and the tumors. I figured if the milk stayed in the breast and hadn't been extracted, that would cause, like you said, an excruciating pain.
Well, and there are some other risk factors. I want to look a little bit more, Dr. Glenn, and we're winding down on time, the cysts and tumors and how they feel different. I want to look at that just a little bit more, and then I'll look at, and we'll give some other risk factors that are outside of that. There are some risk factors that we need to look at, and they have them listed here, and I think it would be good to give those out on the air while we're still on the air. Hey, we're winding down in time, but there's still time for you to call in if you want to call in and be live on the air with us. Maybe you survived. Maybe you had a scare. Maybe you've had surgery. Maybe you've been treated with chemo and you want to call in and share with us and tell us about your victory, or even if you are still battling. We will love to hear your story on today. So we want you to call in, and the phone number again here in the studio is 252-756-2008. You're welcome to call in and be live on the air with us. Hey, this is the Glenn Johnson Show, and you're listening to us on Awesome Radio. We will be right back in a moment.
Keep it locked right here to the Glenn Johnson Show.
Hello, my name is Dr. Wiley Nifong. Thank you for listening to Awesome Radio, 107.5 FM, 1570 AM, WECU.
Welcome back, ladies and gentlemen. We have reached our final 20 minutes of today's broadcast. So without further ado, I just want to say, as a possible going out to the break, if you'd like to call in and share your experience, if you're a survivor, may know somebody that's a survivor, whatever the case may be, you want to share anything, give us a call. We have 20 minutes remaining on the broadcast. I'm going to kick it right back over to Apostle Jacqueline Collins-Williams.
And it says here, a breast tumor, on the other hand, results from cancer cells dividing and growing uncontrollably in your breast. Sometimes a tumor feels like a lump, and sometimes it's only found on a mammogram. So that's why it's so important to get the mammogram, because you could still have a tumor and not be able to feel it. And that's why the mammogram is so important, because for early detection. I do know, that the film or whatever after, it can see the veins in there. It can see everything that is in there. Any strange looking dark areas is what they will look at. They will look at that and see if there's any changes or anything that doesn't look translucent or doesn't look a certain way.
Yeah.
That's how they were able to detect it. I've seen those things. And I've looked too. I was on there looking just like they were looking. Not that I'm a doctor or that I know anything about what I was looking for, but I was definitely looking at the same time they were. They put the film up there and they said, look, everything is clear. I was like, well, I thank you, Jesus, because we don't need to see anything like that. And so here we are. A cyst and a tumor are distinct conditions. This article covers 6 key differences between a cyst and a tumor, including how they feel. And it talks about that cysts and tumors have different causes. Importantly, a breast cyst does not increase your risk of getting cancer later. So you can have a cyst and it doesn't mean that you'll ever get cancer. Sometimes you can get a cyst anywhere on your body. You can get it on your arm, your leg, so just like if you had it on your leg, you wouldn't be automatically running and thinking that you had cancer. So it's the same with the breast, but they would definitely monitor a cyst a little bit more in the breast area than they may do in some other area.
Let me ask you a question. If you remember, our caller that called in last week, and she was saying she only had a dye or contrast with a certain procedure. Was it the MRI or the CAT scan?
I don't remember, Dr. Glenn, but they do contrast dye. And that was one of the things that I wanted to say too, is that the mammogram is not the only diagnostic technique they use, because if you're at higher risk, they are going to need to do the MRI and the CT scans and those other scans just as well as doing along with the mammogram. So it may not be just the mammogram, it may be these other things added as well.
Because I remember she saying that she had to alternate which ones they were going to do because the dye that they gave her made her sick.
Yes, and they were continuing to monitor her to make sure that they had gotten all of the cells.
Yeah.
And then she did chemo after the surgery. Because sometimes, the diagnosis is going to be that they just want to do surgery because it looks like it's localized and they can just take those cells out or they can just remove them. And surgery is easier than sometimes trying to get it through the chemo and other things, especially depending on how it is and whether it has spread. So, it was easier for her to have the surgery, I'm sure. And doctors will determine that. They will determine if surgery is an option. And, you know, if it's surgery and the chemo, or if it's just chemo by itself. And, you know, it's a very, very heavy thing to think about, you know, having to lose your breast or have your breast cut off. I can't even imagine, you know, we as women, you know, some, you know, people, they may think in this world that they may feel like a woman, but they wasn't born a woman. There's something about being a woman and having to come through puberty and going through, you know, the development from zero to having breasts. You know, that's an experience that, you know, it's unlike anybody else. You know, if you go and just instantly get them, you don't understand what you go through to go through puberty, to go, you know, and go through all of that, and then to even look and think that you may have to lose them. You've had to take care of them your whole life or since you were a teen, and now to think that that has to be very devastating. But I'm sure reconstruction and some of the things that help, or some, you know, they just never get them reconstructed, they just leave it. I've seen even now a lot of women modeling and showing where both breasts were removed. And it's common to me. I just have to say this, Dr. Glenn, even though they're gone, you're still a woman, and I just don't feel like that needs to be happening. You still a female, even though they're gone, and maybe you just have scars there. You know, there still should be still should be some shame facing this. Like you don't just get up. You're not a man, so you don't you know, bare chest like a man.
I agree with that because you have some other characteristics that set you apart from male. So, like you said, if they were removed, you're still a female.
Yeah, your femininity is still intact. It should be. You still should be feminine, and it should be something that feels, you know, odd about that. I'm just saying, I've seen people do it, and I know they may have the boldness to do it, but I still feel like, you know, you're a woman, you need to be covered up, you know, regardless to what has happened. You're still a female. You've done it your whole life, so you may as well continue. Dr. Glenn?
I agree with you wholeheartedly because either you're male or female. You can't be one and then be another one at the drop of a dime. You know what I mean?
Oh, yeah. Well, you could look like another one at the drop of a dime, but underneath you still are what you were originally born as.
That's right.
You can't change it. You can modify some things, but you can't change who God made you. And when he birthed you here, that's who you are. And when you die, you're going to have to meet him, and you're going to meet him as you were originally and not what you turned yourself into.
Not to get off the subject because we're going to have 10 more minutes when we come back from the next break, but let me ask you a question. So people that have went, for lack of a better word, people that are transgender, particularly a male who's now a female, you think that person has a right to go to a female restroom?
I absolutely think they should not. And I do not believe they need to be wrestling or fighting women in sports, because underneath is still a man.
That's right. That's what I think.
That's the structure. And, you know, I don't care how many hormones you take or what you add on. I mean, some things is just cosmetic. It's just been added on.
Because you change a person's brain. That male is still a male. It's the way he thinks like a male. He's not thinking like a female.
That's right. And the hormones that are flowing for a man. They are flowing for a male. So they got to take some false hormones or something synthetic to try to make them feminine like a woman.
Testosterone is always testosterone, not estrogen. You can't change that.
Yes. And when you stop taking those false synthetic things, your true hormones are going to start flowing again. Because you cannot change it. You can only try to transform it, but you cannot change it. Underneath, that's who you are. And that's where you're going to stay. I don't want to get into that, Dr. Glenn. That could be a deep subject. I don't want anybody calling me, telling me off, and telling me how they feel and all this stuff. You know, that's your opinion and your issue. But I'm telling you the truth.
That's your prerogative, so we'll leave that alone.
Yeah.
We have 60 seconds before we go to the next and final break. Then we'll be back with our final 10 minutes. Apostle.
I have that one last thing to say. And it's certain things that even when you change it, you're not going to start doing some things that a woman can do. There's some things that only a woman can do and only a man can do. And, God made us perfectly. Hey, we're getting ready to come back for our last break here. And we want you to come on back and hear the ending of this. And we're going to look at some risk factors real quick on our last break. Hey, I know you're enjoying this talk, and hey, I get to going real fast, Dr. Glenn. And I'm sorry, but I like the truth. And I hope we haven't offended anybody with what we stand on and in our own opinions, but we own them and we own the right. Hey, we'll be right back in a moment. This is Awesome Radio. Right back in a moment.
My name is Jayla, and you're to see to my papa, Glenn Johnson, on the radio.
Welcome back, ladies and gentlemen. That was certainly quick. This is our final 10 minutes. So I'm going to let Apostle have his minutes that will end today's broadcast.
Yes, so they say age is a common risk factor, that the older you get, the more likely you are to get breast cancer. But as I said, it is not exclusively about age, because there are young people that have breast cancer. You need to check yourself out no matter what age you are. Drinking alcohol and taking menopausal hormone therapy are also linked to an increased risk of breast cancer. Smoking may also be linked to an increased risk. Risk factors linked to a decreased risk. Some factors are linked to a decreased risk of breast cancer, such as breastfeeding. Now, Dr. Glenn mentioned that earlier, that if breastfeeding could lead to breast cancer, but it is actually causes a decreased risk factor when you're breastfeeding and exercise. Eating fruits and vegetables may also be linked to a decreased risk of breast cancer. So your diet can cause you to have a lesser risk. It says factors under study. Now they're studying and looking at these, that dairy products, fertility drugs, hair dyes, and stress are currently under study. And we know already that they've got studies about the perm that we used to put in our hair, or a lot of people used to put it in, that is causing cancers in some parts of the body.
And the dye.
And the dye. Now they're talking about the dye too. So, I mean, why didn't they say this from the beginning? They never told us in the beginning that those things could cause cancer. How many women have permed their hair? I used to do it for years. And also dyed their hair. And people that are still dyeing their hair.
Well, once again, not to get off the subject, but, sometimes they find out things years and years and years later. Like back in the 80s, there was a certain deodorant that was eliminated off the shelves because it found out it had aluminum in it. The aluminum was causing cancer. You haven't seen that deodorant on the shelf since.
Well, these products need to be tested, and I know, I don't want to say this, Dr. Glenn, but it came right on the tip of my tongue there. They used to do animal testing and see how it went with the animals first. And if it gave the animal cancer, then you definitely don't need to be using it on us or releasing it to us. If it killed a rat, then it definitely doesn't need to be on the market for us. I'm just saying, Dr. Glenn, I'm not against some things.
Yeah,
some people are. They're against animal testing.
Yeah, I understand it, but animals like a human structure.
Yes, that's true. Factors not linked to an increased risk. Well-studied factors not linked to increased breast cancer risk include breast implants and caffeine. So they're saying that having breast implants is not linked to cancer, and neither is caffeine. So drink the coffee as much as you want and get some implants if you need help.
Let me ask you a question, if you know. So the implants, I don't know, there's several types. I know there's a silicone, saline, and stuff like that. There's got to be a couple of them that's worse than the other kind.
Oh, yes. And I think, over time, and we'll have to look at it, Dr. Glenn. I am not an expert on the implants. And, I've known someone that has gotten them because, they wanted a bigger size or whatever, but I'm not well versed on it. So that's what I'm going to say about that. But we can come back and definitely look at it, and I'm going to tell you this, it's a lot of Christian people that believe that you should not have surgery, that however God made you,
That's right.
that you need to stay that way.
I agree.
Do you, Dr. Glenn?
I agree.
I don't know that I agree with that. If something gets bad and something is made oddly, or something is bigger on one side than the other, way bigger, I don't see nothing wrong with fixing it.
I'll tell you why I said that. Everybody knows I'm diabetic. And if your diabetes get really out of control, and particularly if you get an infection in your lower limbs, then they want to amputate. I remember telling my endocrinologist one time, I said, I'm not worried about stuff like that. She said, why not? I said, because first of all, I would have to be in the hospital for you to do that. I'm not going to be there. You have to look for me.
Well, I'm just going to say this, love lifts us up where we belong. Anything that needs to be lifted, we could pray and ask God to lift it back up or do some things to help ourselves. But I don't find an issue with it. I do find an issue with going overboard with surgery, because sometimes if something is going to enhance, and depending on where you are in life, some people, they're on television. They need to be looking better.
You're absolutely right, because that's why I'm here today, because all the things I went through post my motorcycle accident, which could have killed me, and I have a I have a wire mesh that covers the entire right side of my head. Had not had that wire mesh inserted in, I probably wouldn't be here.
And there's some cancer treatments that can cause you to look very old. After you're done taking those treatments, it can make you look 20 or 30 years age of where you are. And so there's nothing wrong with something happening. This is how I feel, and it's going to help you and make you feel better to be able to get those things, and it's wrinkled your face and got you saggy, or you looking way, way older than what you are because of something that is out of your control. I don't have a problem with it.
I think what it boils down to is sometimes you have to go through an extreme thing to get something accomplished for yourself.
Oh, yes. And, it's left up to the individual. It's your own conviction. If you think not, then God bless you with that. But I say go for it. If you need it, if it's going to help you, go for it.
One more thing I want to mention to that end. If I had not had the surgery after they removed my tracheotomy, I definitely know I wouldn't be here, because prior to the surgery, I couldn't even breathe. And if you can't breathe, what happens?
You're going to die.
Thank you. So,
and then you had some reconstruction.
Yeah, so I praise God. Yeah. Definitely praise God for all. That was divine intervention.
Yes, I'm grateful for doctors and their ability to reconstruct things after something has happened.
Yeah.
We need that. And so I don't have an issue with it. Get reconstruction, get plastic if you want to, plastic surgery, however you want. Do whatever you need to help you and to help you feel better. Dr. Glenn?
I'm glad you mentioned that, because, ladies and gentlemen, all of the information we share with you today, we don't want to discredit any medical facility or any particular doctor. All the things we share today is commentary that we have researched. You still should consult with a medical professional for further advice.
Definitely. And we want to say that neither one of us are medical doctors, and I've denied that right away. Some things are opinionated, but you also should seek the advice of a physician concerning your situation, and also pray about it. See what God has to say about your circumstance, and not go by other people's opinion.
Because prayer works. Believe me when I tell you.
It definitely does. I'm going to see about praying some things up and helping to, you can do better, and you can feel better. There's some things that prayer and exercise will help, Dr. Glenn.
By the way, next Wednesday, we'll have Sergeant Lee Darnell in here with us from the Pitt County Sheriff's Office. He is the public information officer for the Sheriff's Office, the PIO. We'll be doing a continuation and final part of senior check program and the house check program. That's why we invited him on, because he's a public information for the sheriff's office.
Hey, we hope that you've enjoyed our show on today and that some of the information was helpful for you. We're also grateful for the Sherry Shepherd's, her audio that we shared here, and we hope that it made you laugh. We hope to see you right back here on next week, here on the Glenn Johnson Show, and with Dr. Glenn Johnson and Apostle Jacqueline Cullins-Williams. God bless you, Dr. Glenn.
Want everybody to have a pleasant day, pleasant weekend that's approaching. Be safe as always. If you see something, say something. Don't let anything get past you. And to all the women who are survivors of breast cancer, I say God bless you. Take care of yourself. Do what you have to do to stay healthy. And may God bless all of our listeners listening today. With that, I'll say, may the Lord take a liking to you. God bless you all. We'll see you next week. Awesome Radio 107.5 FM.